Good afternoon, happy Saturday to you all. I am Sanjeev Pandya. Namaskar, hello and welcome to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. And in this show, we talk about importance of Ayurveda and how Ayurveda with the Panchakarma treatment and the right herbs can prevent or cure any disease that you may have. And for that, Dr. Ambika Nair, who joins us in this show every week to guide us and educate us about Ayurveda. She is with us once again. Hello, Dr. Ambika Nair, and welcome to the show.
Thank you so much for inviting me, and really namaskaram to all my viewers who are watching this show.
And the viewers, thank you so very much for your comments, suggestions about the show. And we actually encourage you to send in your questions, any questions you have about any disease and want to know more about Ayurveda.
Yes.
Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center will definitely advise you and guide you. But meantime, thank you so much for watching the show, and thank you for your suggestions and the comments. We really appreciate it. You know, Dr. Nair, as we make sure that our viewers address, their questions and their concerns are mentioned in the show. In today's episode, the viewers have requested to talk about antenatal care and importance of antenatal care.
Very nice.
Yes. So, what is actually antenatal care? It has to do with pregnancy, but Dr. Nair, tell us in detail, what is it?
Yeah, that is, like antenatal care in our modern language, and Garfini, Garbham is pregnancy. Okay, and Garfini Parijariya and Prasuti Karma in Ayurveda.
Okay.
This is what, we talk. Nowadays, everybody plans. So, they don't even conceive for like 5 years, 6 years, 7 years. So they are all settling in their life. So after settling only they think of, like, some people want the child, they go to the doctor, see the care. Before conception they should take care of their body. This is what I want to tell. It's easy, like we get a lot of autistic children and so many abnormal children. So it is better if you have any disease or if you are suffering from anything, you should always treat it properly so that the conception will be easy and you will always have a very healthy child.
Okay,
mentally and physically.
So what you're saying is pre-antenatal care.
Pre-antenatal is very important.
Achha.
Okay. Then comes antenatal. Because we get a lot of complicated cases, that's the thing, then we come about, antenatal. Okay. Pre is more important and antenatal care is another important thing.
And how Ayurveda actually can help in pre-antenatal or antenatal care?
Yeah, pre-antenatal, how people will come is, doctor, we are trying since so many years. We have tried IUI, IVF, and all. It's just like infertility, understand? So they come and they ask us, that we were doing for a long time, what to do. So we see the person and do the pulse analysis, Nadi Pariksha, then we see that where they have gone wrong, whether it is with the hormonal imbalance, whether there is any block in the inner uterine area, in the endometrium or endometriosis, or in the tubes or anything like that, then we have very good Panchakarma treatments also for that actually. Okay. We'll be telling now how they are doing the antenatal care, okay, how we do it.
Correct.
Okay. Because it always varies. And especially during the pregnancy, they are prone for, because their system also become little weak, because they will have to carry one more life inside.
Exactly.
So that is more, so counseling is more important, educating them is more important. Some people like little vomiting, little hyperemesis gravidarum means they are so tired with that, they cannot go for the work, they cannot do any routine work or something like that, So from the first month we start.
Achha.
So we make a plan like a first trimester, second trimester and third trimester, Yeah. So first trimester we'll tell them, certain herbs are there, they should not have any constipation, and their diet also we will write, which herbs they should use.
Correct.
So educate them in a very proper way.
So this can be parallel to their gynecologist.
Yeah, they go to their gynecology because it's very important in this country. But in India means, they go, but like because for the delivery. Here also they take care, they come to me, and so many people, they just only go for the delivery. They go to their doctor for the blood work, everything.
And there are other also what I call, I don't know, it's a classes or workshops, something for pre-pregnancy that
they have.
that the gynecologist recommend.
They recommend.
So that can be parallel also.
Yeah,
with
they
Ayurveda
how to take care of the, here they educate a lot also, but see in Ayurveda, see, to get the problems, it is very easy, but to come out, it's very difficult. So first, the once they miss the periods itself, they have conceived. Okay, so complications are there. Like they get, in the urine there will be like albumin formation, so that we call it as pre-eclamptic toxemia. So all the toxins, they will get swelling on the foot, and their blood pressure varies. So these all, when they come, when they are with us, we tell them what to do with the diet and how to take care of that, and not only that, diabetes, gestational diabetes, I'm doing how many I'm doing, I have no idea. I'm telling you. Okay.
Really?
So many clients are there, so many, very healthy babies are born, and they are very happy with that. So we tell them how to go with that.
So it's really good to know that people in our community, they understand importance of Ayurveda when it comes to this antenatal care, and especially pre-antenatal care. So they have knowledge of it. They know Ayurveda really benefits a lot. And it's a good thing that this is in parallel to their regular doctor's treatment, regular doctor's visits, and the regular medicines that they
whatever they are taking, we don't hinder in that.
Correct.
And some people willfully, they don't take it because the doctor says that you are much better. Okay. And nowadays, so many people, they come. Before that, we want to make an appointment with you, so that we, we want to have a baby. So before that, we want to do the panchakarma. Some days it will be like 2 weeks for them, okay, to manage them. Then some people, for the gents, sometimes, the count is less or something like that. Then we do 1 week or some. That's what I told you, treat for the cause, what they need. Some days just it is a few days of panchakarma for them.
Okay.
Some people doesn't need it also, you understand?
Correct.
So we go accordingly. It all depends upon person to person.
But anyway, we still have to talk about importance of this antenatal care, and we'll do so right after the break. You are watching Ayurveda Mantra Show by Santigram, Kerala Ayurveda Wellness Center, USA. We'll be right back after these messages. Welcome back to the Ayurveda Mantra Show by Santigram, Kerala Ayurveda Wellness Center, USA. In this episode, we are talking about antenatal care, pre-antenatal care, which actually has to do with pregnancy. And Dr. Ambika Nair of Santigram, Kerala Ayurveda Wellness Center is once again telling us importance of antenatal care when it comes to Ayurveda. Can Ayurveda be very helpful in, well, let's say, very complicated pregnancies? Because there are some ladies out there.
Very complicated cases.
Correct.
Yeah.
And how it can be helpful, where actually modern medicine may not be that much of helpful. How Ayurveda can be helpful in that?
So many cases comes to us, cervical incompetence, so many habitual abortions and everything. So every month they come for a checkup. Actually, they come and see. It is like a follow-up, and first month what their diet. They should always take light diet, which will easily digest. Okay, till the 3 months. Then we have to Garphasthapaka Drivyas. We have Brahmi, Brahmi Gridam, Sadavari, all those things. We will give them. Because the panchakarma will be done only for a few days, it's not through the 9 months we don't do it.
Because this is a pregnancy, yes.
Some people are very anxious also, so Brahmi Gridam, this all will help a lot, so that then it will establish the child. The fetus is growing actually, so accordingly we tell them, how to go with that diet. Okay, so more cooked food we will give them. Anything they can take it, but it should not be very cold, because the peristaltic, movements can start. So that is not advisable. Very cold and very warm food we don't give them. Okay, ask them to drink a lot of water and not to sleep during the day.
Not
That
to
is
sleep
more,
during the
yeah,
day.
because
Okay.
actually the kapha will increase, because that's not right actually.
Acha,
So we
acha,
tell
acha.
them, after 3 months, because the heartbeat always starts. All the child is well established now. Whatever the child want to eat, he will be telling through the mother only.
Exactly.
So that's where the pica of pregnancy comes. What they must have not ate in their whole life, they will start liking for
Because
it.
they get that urge. They
Yeah,
get
that is the urge. That is
correct.
called a pica of pregnancy.
That's
Okay, so if they may not eat anything, like not even some people vegetarians, they tell that I was liking to eat only egg. So we will, okay, that is the pica of pregnancy. So the diet is always like a little frequent diets will be given. See, to avoid complication comes, that plays a major part in by Ayurveda. We always observe whether they have any edema, like swelling in the feet, whether any variation in the blood pressure, whether their sleep is, like a tan man, body and mind has to be brought in a very, very balanced way, because their sleep is must. Whether they have any allergies, endocrinology, that is the thyroid is totally balanced, because we know through the pulse. Still they go with their doctor also, they see that whether it is balanced or not. We have like a lot of children born recently also.
All right, so what you're saying is that especially in the pre-antenatal care, how important Ayurveda is, right? Panchkarma therapy not needed for these pregnant women, because you really can give Panchkarma treatment after a couple of months, after first
No,
couple
we
of months.
give, but that will be in a different way. During the antenatal care, some people, like severe backache, some people will have it. Okay, so at that time, like in a different
But
positions,
it's very minimum.
but a very minimum, very minimum.
The most important thing comes into factor is herbs. How do you choose right herbs for this pre-antenatal or antenatal care?
Like we have like Bella, Shatavari, I told, like Brahmi is there, Garbharekshani we call it as Dhanvantaram. Because all the, like Vayu will be, see, like some people, like you see that after the delivery, they say that, they had so many mental issues, they were in so much of stress, they were taken to the hospital and all. So all these complications can be avoided actually. So these people, like if they come to us, it is really taken care very properly.
Achha.
Yeah. And not only that, like thyroid patients, like see, autistic children, they come to me. Okay, so when we do the treatment, the parents wanted for a second baby, so they come, will you be able to help us? Definitely. You people will be seeing the show, you know that you all came to me and how many children are born even recently. So that also we help, both the parents. So at that time, proper Panchakarma was done. The thyroid was brought under totally control. No other medications, no complications. Very little herbs and little exercises. Babies are born without any congenital abnormality, or even, I cannot say congenital abnormality like that, but at least complications, I should say.
This is all in importance of two lives. We're talking about two lives.
Two
One
lives,
is
yes.
mom, her life, and the other life that she's carrying it inside of her. So we're talking about two important lives that we want to make sure that both lives remain healthy after baby is born. Okay. How long this treatment lasts?
It lasts even, like even after the everything, like then we teach them, how to take care later.
Care of themselves, yes.
See, like I always tell, तुम्हारा खेत सही होगा तो तभी तो बीज तुम भिगो सकते हो, like भिजा सकते हैं ना, because it's very important actually. See, with the after getting all the complications, then like you have to do a lot of things, like even herb also will increase. Correct. It doesn't decrease. It will, even after the delivery also, see, their milk will be sufficient, they will be eating proper food. Okay, whether it is, I am not telling they should not be, they should be only vegetarian, there are so many non-vegetarians also. Correct. So we tell them what to eat. They can eat like soups, like even goat meat, goat soups, ghee, everything we give them. We see that they sleep properly, and this like little backaches, all those things, like some people get a lot of sciatica issues with the lower back. Correct. Especially during the, like if the baby is very big and all, they really suffer a lot. So this all we take care a lot.
Antenatal care and its importance, that's what we are talking about in this episode. We're going to take a short break, and after the break we'll come back and we'll talk more on this same matter. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. We are talking about antenatal care and its importance. That's pregnancy, before pregnancy, and during pregnancy. How important is that? Dr. Nair, have you ever came across a patient, or rather a family, where first baby was born and they didn't follow all this Ayurveda treatment? They never knew about Santigram Kerala Ayurveda Wellness Center, let's say hypothetically speaking. And for the second pregnancy, they decided to try Ayurveda. Maybe they heard from other people that how important is that. And the baby was born also. I mean, have you noticed any kind of change in two babies, or when it comes to health, baby's health, we're talking about it?
I have seen that after not only about Shantigram, any like Ayurveda physician, if they have really gone and under their care means the child, it's like a super child, I should say.
Oh, okay.
It's
so it really
so much a difference. I could see that, like so much of difference. I'm not telling that those who did not go to Ayurveda, or come to Shantigram, only the child will be good. But I have seen that no anomalies. I have seen that, and their focus is good. Like ADH is very common in this country. Focus issues, and they are very, very nice in grasping everything, physically and mentally, I should say.
And even if you're telling our viewers about Santigram Kerala Ayurveda Center and a kind of treatment that they give for this antenatal care, right? There's nothing wrong in it, because it's to their benefit. It's to their benefit. It's to the baby who's going to be born, to that baby's better health. So there's nothing wrong in it.
The quality has to be taken care. It is your product.
Yes, exactly.
It is going to, build the nation actually, the child.
And you
so what you want to invest? See, like I really joke with the patients sometimes, because I always tell that you have time for everything else. For when you are doing this, you please think of it. It's not for Shantigram or any Ayurveda benefit. It is for your own people. The child should be, the child is our product.
Correct.
It has to be taken care. Then only, like afterwards, like it is like, like इतना बड़ा जैसे पौधे में तो काम कर सकते हैं ना, पौधा भिगोने से पहले तो you should see.
That is true, and that should be taken in consideration. But on the other hand, we also want mom, yani ki mother, to be also happy and healthy. We don't want to have any complications after baby delivery or nothing like that. That lady should remain very happy and healthy also. Even at Santigram Kerala Ayurveda Wellness Center, where Dr. Nair has said that many individuals who have come in for treatment, pre-antenatal care and antenatal care also, and they have seen
postnatal care also.
And postnatal. How does that work now, postnatal?
It is same, like one more entity to your home. Everything before you were alone. So to accommodate breastfeeding, okay, and the things what they should eat. Diet is more important. Certain herbs which will help them. Some people, they eat a lot at that time, they put on so much of weight. Again, kapha problems, So this all we will make them understand, and they will remain more young. You will not believe it.
Yes.
Instead of becoming old, they become very young later.
Very nice. Yeah. And what I find it very interesting, thing is that this entire Ayurveda thing, whether for antenatal care or for any disease, right? This thing doesn't have any side effects.
No, not at all.
You go to allopathy and other medicine, there will be a side effect attached to it. You may put on a weight, you may, lose some weight, you may have some other body complications, and there will always be a side effect. But this is one thing which has no side effect.
No side effect.
And it works 100% effectively.
Yes, it is. It's very effective, and not only that, they should all see once somebody comes to me, especially for other certain things, I always tell, how much you are going to help, I will help you more. अगर आप ठीक नहीं होना चाहते तो मैं तो fail हो जाएगा. I ask them, in a joking way, you want me to fail in life? No. They will always tell me like that. And the mental health of the mother has to be taken care in antenatal. It is very, very important. That's why we give them Brahmi Ghrutam, Saraswata Ghrutam, like so many things, accordingly, so that the child will be very brainy child. Without any mental issues, they will come.
Correct. And a husband
we educate
or father
the family.
Correct.
We educate the family. If any in-laws or somebody is there, if any a husband only in this country more, we tell them that you have to take care. how you should help the wife. You know, like
Exactly.
it's
That's what I'm
a
saying.
real understanding. I feel that here more people are more understanding. I should say.
Yeah. And over the years, I think Santigram Kerala Ayurveda Wellness Center, they have worked very hard to create an awareness, and they have helped thousands of individuals in this country. And this is actually Santigram Kerala Ayurveda Wellness Center, which originates from Kerala. And Kerala is a focal point when it comes to Ayurveda, and we know that how well and how authentic and true Ayurveda and a Panchkarma and a herb treatments are in Kerala, and they actually bring that thing, the originality from Kerala, here into USA. Dr. Nair, before we say goodbye to our viewers, today's Ayurveda tips, please.
Yeah, especially for the antenatal, you know, like you should not take anything very cold. So no ice cream at night.
Achha.
If whatever you want to take, you can take in the daytime, but try not to take very cold things. And if you have any issues with the urination or any, you know, like a water retention, like a swelling in the body and all, check your urine, see whether you have any albumin, go to your doctor, find out, you know, like don't overeat. They will tell that, you know, like I have to eat a lot of protein. So don't overeat. Whatever digests in you, only you should eat.
Okay.
That is more important.
Eat
actually.
it multiple times a day.
They can eat a lot.
But just go with a smaller portion.
And you know, like a gestational diabetes and all, you can always prevent it. So if anything like that, you know, you are welcome to ask me anything. I am there to help you.
Okay. And speaking of asking anything, viewers, please make a note of our email ID, info@santigramusa.com. Any question you have, anything that you want to know on Ayurveda or any disease, Dr. Ambika Nair or any one of our staff members will be definitely help you out. But do send in your questions or concerns, info@santigramusa.com. Dr. Nair, once again, thank you so very much for your time. Thank you for your valuable input.
Namaskaram. Keep watching. Stay healthy.
Stay healthy. Keep watching. Next week, we'll talk about another important disease and how Ayurveda can prevent or cure that disease. And this is the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. Thank you for watching it. I am Sanjeev Pandya, wishing you all happy weekend and happy and healthy life ahead.